Absolutely. Since this is a 61-slide lecture, it's too long to fit into a single response. I'll convert it into the same audio lecture format you've liked before. Conversational, easy to follow with Speechify, definitions built into the lecture, important exam tips, and mini summaries. The lecture is based on your uploaded slides. Part 1. Infection Control Audio Lecture Notes. Introduction. Today we're learning about infection control. Infection control is one of the most important subjects in dental hygiene because every patient must be treated as though they could carry an infectious disease. The goal is not to identify who is sick. Instead, the goal is to prevent disease transmission between everyone in the dental office. Remember this idea throughout the lecture. Treat every patient, every surface, and every instrument as potentially infectious. What is infection control? Infection control is a set of procedures designed to prevent microorganisms from spreading between patients, dental healthcare workers, and the community. The main goals are reduce the number of pathogens, break the chain of infection, prevent cross-contamination, protect both patients and healthcare workers, prevent healthcare-associated infections, also called HCIs. If a dental healthcare worker has a contagious illness such as measles, chickenpox, hepatitis A or E, influenza, or COVID-19, they should stay home to avoid spreading infection. Mini summary. The purpose of infection control is to reduce germs and stop diseases from spreading. Common pathogens in the mouth. A pathogen is any microorganism capable of causing disease. Important pathogens found in the oral cavity include cytomegalovirus, a virus that usually causes mild illness but can be dangerous for immunocompromised patients. Hepatitis B, a virus that infects the liver. It spreads through blood and body fluids. This is one of the biggest occupational risks for dental professionals. Hepatitis C, another liver virus spread through blood. Human immunodeficiency virus, a virus that attacks the immune system. Herpes simplex virus types 1 and 2, causes cold sores and genital herpes. Mycobacterium tuberculosis, the bacterium that causes tuberculosis. Staphylococcus bacteria, common bacteria that can cause skin infections and MRSA. Streptococcus bacteria, common oral bacteria that can cause cavities, sore throats, and other infections. Influenza virus, the flu virus, SARS-CoV-2, the coronavirus responsible for COVID-19. Exam tip. No HBV, HCV, HIV, tuberculosis, influenza, and COVID. These are tested frequently. Sources of contamination. Contamination means harmful microorganisms have been transferred to a person or object. There are several ways contamination occurs. Direct contact. Touching blood or body fluids directly. Example, a needle stick injury. Droplets, large particles produced when someone coughs, sneezes, or during ultrasonic scaling. Fomites. A fomite is any contaminated object that can spread disease. Examples, door handles, dental chair controls, light handles, pens, instruments, ingestion, swallowing contaminated material, sexual contact, spread through bodily fluids, animal carriers. Some diseases are spread by animals or insects. Definition. Fomite equal to an inanimate object capable of transmitting pathogens. What determines whether someone becomes sick? 3 major factors determine whether infection develops. 1. Virulence. Virulence means how harmful or aggressive the microorganism is. A highly virulent organism causes disease more easily. 1. Dose. Dose refers to the number of microorganisms entering the body. More microorganisms usually increase the chance of infection. 1. Host resistance. This refers to the person's immune system. Healthy people usually resist infection better than immunocompromised individuals. The goal of infection control is to reduce the dose of microorganisms that people are exposed to. Mini summary. Disease depends on how dangerous the germ is, how many germs enter the body, how strong the immune system is, how microorganisms spread. Disease can spread in many directions. Patient to dental hygienist, dental hygienist to patient, patient to patient, dental hygienist to family, dental hygienist to office staff to family and community. This is why infection control protects everyone, not just patients. Breaking the chain of infection. Every infection follows a chain. The chain includes 1. Infectious agent, the microorganism causing disease. 1. Reservoir, where the microorganism lives. Examples: people, water lines. Instruments. 1. Portal of exit, how it leaves the reservoir. Examples: blood, saliva, respiratory droplets. 1. Mode of transmission, how it spreads. Examples: direct contact, indirect contact, airborne transmission, droplets. 1. Portal of entry, how it enters another person. Examples: eyes, nose, mouth, broken skin. 1. Susceptible host, someone whose immune system allows infection to occur. If any one link in this chain is broken, infection cannot spread. CDC 4 Principles of Infection Control. The CDC organizes infection control into 4 major principles. Principle 1. Take action to stay healthy. This includes vaccinations, hand hygiene, education, post-exposure management. Principle 2. Avoid contact with blood, aerosols, and infectious substances. This is accomplished with PPE. Examples: gloves, masks, protective eyewear, gowns. Principle 3. Make patient care items safe. Reusable instruments must be cleaned, disinfected when appropriate, sterilized. Single-use items are discarded. Principle 4. Limit the spread of infectious substances. This includes surface barriers, surface disinfection, proper waste disposal, sharps disposal, memory trick. Stay healthy, protect yourself, sterilize instruments, control the environment, modes of transmission. There are 4 major ways infection spreads in dentistry. Direct contact. Blood or saliva directly touches another person. Example: blood splashes into your eye. Indirect contact. Transmission through contaminated objects called fomites. Examples: instruments, countertops, light handles. Airborne transmission. Tiny particles remain suspended in the air. Dental procedures producing aerosols include ultrasonic scaling, air polishing, coronal polishing, air-water syringe. Droplet transmission. Large respiratory droplets contact eyes, nose, mouth. These droplets usually travel short distances before falling. Exam tip: remember, direct equal to person, indirect equal to contaminated object, airborne equal to tiny aerosol particles, droplet equal to larger respiratory droplets. Recommendations versus regulations. These are often confused. Recommendations: these are guidelines. They are not legally enforceable. Organizations making recommendations include CDC, AD, CDA, Association for Dental Safety. Regulations: these are laws. They are legally enforceable. Organizations include OSHA, Cal-OSHA, FDA, EPA. Easy way to remember. Recommendations equal to suggestions. Regulations equal to laws. Major infection control agencies. CDC focuses on preventing disease, creates infection control recommendations. Many regulations are based on CDC guidelines. ADA develops scientific standards, evaluates dental materials and equipment, awards the ADA Seal of Acceptance. Association for Dental Safety provides education and resources about infection prevention. OSHA protects employees, requires safe workplaces, created the blood-borne pathogens standard, requires employers to offer the hepatitis B vaccine to employees at occupational risk. FDA regulates medical devices and medications. Examples include gloves, masks, dental instruments. EPA regulates disinfectants and oversees medical waste after it leaves the dental office. Final summary. After this section, you should know the purpose of infection control, common oral pathogens, sources of contamination, the 3 determinants of infectious disease: virulence, dose, and host resistance, the chain of infection and how to break it, the CDC's 4 principles of infection control, the 4 modes of disease transmission, the difference between recommendations and regulations, the roles of CDC, ADA, ADS, OSHA, FDA, and EPA. Perfect. Here's part 2 in the same audio lecture style for Speechify. This section covers blood-borne pathogens, standard precautions, transmission-based precautions, PPE, and hand hygiene. It is based on your uploaded lecture slides. Part 2, Infection Control Audio Lecture Notes. Blood-borne pathogens. One of OSHA's most important infection control standards is the blood-borne pathogen standard. A blood-borne pathogen is a microorganism that is carried in blood or certain body fluids and can cause disease in humans. The 3 blood-borne pathogens you absolutely need to know are hepatitis B virus. HBV attacks the liver and is the blood-borne disease that dental professionals are most likely to encounter occupationally. It is highly contagious, but vaccination provides excellent protection. Hepatitis C virus. HCV also infects the liver. Unlike HBV, there is currently no vaccine. Human immunodeficiency virus. HIV attacks the immune system by destroying important white blood cells called CD4 T cells, making it harder for the body to fight infections. OSHA first created the blood-borne pathogen standard in 1991 to protect healthcare workers who may be exposed to blood or other infectious materials while performing their jobs. In 2001, the Needle Stick Safety and Prevention Act strengthened these protections by encouraging safer needle devices and reducing sharps injuries. California has its own state regulations through Cal-OSHA, but they follow the same general principles as OSHA. Exam tip. Know these 3 viruses: HBV, HCV, HIV. These appear on almost every infection control exam. Other potentially infectious materials. Blood is not the only material capable of spreading disease. OSHA uses the term other potentially infectious materials, or OPM. Examples include semen, vaginal secretions, cerebrospinal fluid, any body fluid visibly contaminated with blood. These materials are treated exactly like blood because they can also transmit blood-borne pathogens. Definition: OPM equal to body fluids capable of transmitting blood-borne diseases besides blood. Standard precautions. One of the most important concepts in dentistry is standard precautions. Standard precautions were developed by the CDC. They state that every patient should be treated as if they are infectious, even if they appear healthy. Standard precautions apply to blood, saliva mixed with blood, body fluids, secretions, excretions except sweat, non-intact skin, mucous membranes. Years ago, these were called universal precautions. The name changed because standard precautions include more than just blood. They include many body fluids and situations where infection can spread. Memory trick. Standard precautions mean treat everyone the same. Never assume someone is disease-free. Transmission-based precautions. Sometimes standard precautions are not enough. Certain diseases require additional protective measures based on how they spread. These are called transmission-based precautions. There are 3 types. Contact precautions, used for diseases spread through touching contaminated people or surfaces. Droplet precautions, used for diseases spread through larger respiratory droplets. Airborne precautions, used for diseases spread through tiny airborne particles that remain suspended in the air. Patients with suspected or confirmed tuberculosis require special airborne precautions because TB spreads through very small airborne particles. COVID-19 may also require transmission-based precautions depending on current public health recommendations and the patient's condition. Mini summary. Standard precautions are used for every patient. Transmission-based precautions are added only for certain infectious diseases, keeping dental healthcare workers healthy. The first step in infection control is protecting yourself. Healthcare workers should stay current on recommended immunizations. Important vaccines include hepatitis B, chickenpox, rubella, measles. Vaccination protects both the healthcare worker and every patient they treat. Exam tip. If OSHA asks employers to offer one vaccine, it is the hepatitis B vaccine. Personal protective equipment. Personal protective equipment, or PPE, creates a physical barrier between the healthcare worker and infectious materials. The main types of PPE are gloves. Protect the hands from blood, saliva, and contaminated surfaces. Masks. Protect the nose and mouth from droplets and aerosols. Protective eyewear. Protects the eyes from splashes and flying debris. Gowns or protective clothing. Protects clothing and exposed skin from contamination. Every piece of PPE is designed to reduce exposure to microorganisms, not eliminate them completely. PPE works best when combined with proper hand hygiene and environmental cleaning. Memory trick. 4 main PPE items: gloves, mask, eyewear, gown, hand hygiene. Hand hygiene is considered the single most effective way to prevent disease transmission. Even when gloves are worn, hands must still be cleaned because gloves can have microscopic tears or become contaminated during removal. Perform hand hygiene before treating every patient, after treating every patient, before putting on gloves, after removing gloves, anytime your hands become visibly contaminated. The purpose of hand hygiene is to remove transient microorganisms before they spread to another patient or surface. Personal hygiene. Healthcare workers should also maintain good personal hygiene. This includes keeping fingernails short and clean, avoiding artificial nails if they interfere with infection control, maintaining clean clinical uniforms, avoiding excessive jewelry that traps bacteria, keeping hair secured away from the treatment area. The goal is to reduce places where microorganisms can collect and spread. Why PPE alone is not enough. Many students think gloves alone prevent infection. That is incorrect. Gloves protect your hands, but microorganisms can still spread by touching your face. Removing gloves incorrectly, touching contaminated instruments, touching countertops, using contaminated pens or keyboards. This is why infection control always combines hand hygiene, PPE, cleaning, disinfection, sterilization, safe work habits. All of these work together to prevent disease transmission. Quick review. Know these definitions. Blood-borne pathogen. A microorganism spread through blood that can cause disease. OPM. Body fluids besides blood that can also spread blood-borne pathogens. Standard precautions. Treat every patient as though they are infectious. Transmission-based precautions. Extra precautions used for diseases spread by contact, droplets, or airborne transmission. PPE. Protective equipment that creates a barrier between healthcare workers and infectious materials. End of Part 2 summary. By now you should understand what blood-borne pathogens are, the differences between HBV, HCV, and HIV, what OPIM means, why OSHA created the blood-borne pathogen standard, the difference between standard precautions and transmission-based precautions. The 4 main types of PPE. Why immunizations are important. Why hand hygiene is considered the most effective infection control practice. Perfect! Here's part 3 in the same audio lecture format. This section covers some of the highest yield topics for dental hygiene exams, PPE, masks, gloves, clinical attire, sharp safety, exposure incidents, and dental unit waterlines. It is based on your uploaded lecture. Part 3, Infection Control Audio Lecture Notes. Introduction. So far, we've learned why infection control is important and the basic precautions every dental professional must follow. Now we're going to learn how to actually protect ourselves while treating patients. Remember this important idea. PPE is your last line of defense. The best protection is always preventing exposure in the first place. Personal protective equipment. PPE stands for Personal Protective Equipment. PPE creates a physical barrier between healthcare workers and infectious materials. The lecture lists 4 major categories: eye and face protection, masks, protective clothing, gloves. These are used together. Wearing only one piece of PPE is not enough. Clinical attire. Clinical clothing protects both the provider and the patient. Examples include protective gowns. These prevent blood, saliva, and aerosols from contaminating your clothing. Surgical caps. These help keep hair away from contaminated aerosols and reduce contamination of the clinical environment. The purpose of clinical attire is to prevent microorganisms from leaving the treatment area on your clothing. Remember, your scrubs are considered contaminated after treating patients. Personal appearance. The lecture emphasizes maintaining professional hygiene. Good personal hygiene includes keeping hair secured, maintaining clean uniforms, keeping fingernails short, avoiding excessive jewelry, using hand lotions that are compatible with gloves. Jewelry, long nails, and loose hair can trap bacteria and interfere with proper glove use. Exam tip. Artificial nails are generally discouraged because microorganisms collect underneath them. Masks. Masks protect your nose and mouth from splashes, droplets, and aerosols. The lecture compares 2 different types. Surgical masks. Surgical masks are FDA-approved, ASTM certified, fluid-resistant, Loose-fitting, they protect against large respiratory droplets, some aerosol particles. However, they do not provide reliable protection against very small airborne particles because air can leak around the sides. N95 respirators. N95 respirators provide much greater protection. They are approved by NIOSH, tight-fitting, designed to filter at least 95% of airborne particles. When properly fitted, there is very little leakage around the mask. This makes them much more effective against airborne diseases such as tuberculosis. Surgical mask versus N95. A simple comparison. Surgical mask, loose-fitting, protects against splashes, protects against droplets, not reliable for very small airborne particles. N95, tight-fitting, filters at least 95% of airborne particles, much better protection against airborne diseases, requires proper fit testing, memory trick. Surgical mask equal to droplets, N95 equal to airborne. Eye protection. Your eyes are another portal of entry for disease. This is why protective eyewear is required. Protective eyewear shields your eyes from blood, saliva, ultrasonic aerosols, flying debris. Many providers also use face shields for additional protection. Remember, regular prescription glasses are not considered adequate eye protection because they do not completely cover the sides of the eyes. Gloves. Gloves protect your hands from contact with blood and saliva. The lecture discusses 3 major glove types. Medical examination gloves. These are the gloves most often used during routine patient care. Examples: examinations, dental hygiene procedures, routine restorative procedures, sterile surgical gloves. These gloves are sterile before use. They are used during surgical procedures where maintaining sterility is essential. Examples: implant surgery, oral surgery, periodontal surgery, heavy-duty utility gloves. These are thicker gloves. They are not worn during patient treatment. Instead, they are used for cleaning instruments, handling contaminated instruments, cleaning sterilization areas, handling chemicals. Because they are thicker, they are much less likely to tear during instrument processing. Exam tip: never use examination gloves while cleaning contaminated instruments. Always switch to utility gloves. Proper glove use. Gloves should be changed between every patient, whenever torn, whenever punctured, whenever heavily contaminated. Hands should always be washed before putting gloves on. After removing gloves, remember, gloves are single-use items. Never wash gloves. Never disinfect gloves for reuse. Sharps safety. Sharps include anything capable of cutting or puncturing skin. Examples include needles, scalpel blades, broken anesthetic carpules, orthodontic wires, explorer tips, scalers. Sharps injuries are dangerous because they can expose healthcare workers to blood-borne pathogens. Preventing sharps injuries. Always pay attention while handling needles. Never pass uncapped needles carelessly. Dispose of sharps immediately. Use approved sharps containers. Never place needles in regular trash. The fewer times you handle a sharp instrument, the safer you are. Memory trick. Use it, dispose of it, never leave it lying around. Exposure incidents. Sometimes accidents happen. Examples include needle stick injuries, blood splashes into the eyes, blood entering the mouth, blood contacting broken skin. These are called occupational exposures. If an exposure occurs, stop treatment. Wash the affected area immediately. Flush eyes with water if necessary. Report the incident. Follow the office's exposure protocol. Seek medical evaluation if indicated. One important part of Principle 1 from the CDC is post-exposure management, meaning every office should already have a plan before an accident happens. Dental unit water lines. One source of contamination that many students forget is the dental unit water line. Water lines can develop biofilm. Biofilm is a thin layer of microorganisms that sticks to the inside of tubing. If biofilm is allowed to grow, patients may be exposed to bacteria. Aerosols may become contaminated. This is why water lines require regular maintenance according to infection control guidelines. Remember, the water coming from the handpiece or ultrasonic scaler is not automatically sterile. It must be properly maintained. Why aerosols matter? Many dental procedures create aerosols. Common aerosol generating procedures include ultrasonic scaling, air polishing, air-water syringe use, high-speed handpieces, These tiny particles can remain suspended in the air and spread microorganisms throughout the treatment room. This is why PPE, high-volume evacuation, and proper room disinfection are so important. Quick review. Know these definitions. Clinical attire, protective clothing worn to reduce contamination. Surgical mask, a loose-fitting mask that protects mainly against droplets and splashes. N95 respirator, a tight-fitting respirator that filters at least 95% of airborne particles. Utility gloves, heavy-duty gloves used during instrument cleaning. Sharps, any object capable of cutting or puncturing skin. Biofilm, a layer of microorganisms attached to surfaces such as dental waterlines. Occupational exposure, exposure to infectious materials while performing your job. High-yield exam facts. Know the difference between surgical mask versus N95. Examination gloves versus utility gloves versus sterile surgical gloves. Know that N95 filters at least 95% of airborne particles. Utility gloves are used for cleaning contaminated instruments. Sharps always go into an approved sharps container. Waterlines can develop biofilm. Hand hygiene is required before and after gloves. End of Part 3 Summary. You should now understand the purpose of PPE, clinical attire requirements, the differences between surgical masks and N95 respirators, types of gloves, and when each is used. Sharp safety, what to do after an exposure incident, why dental unit water lines require maintenance, why aerosol generating procedures increase infection risk. Perfect. This is the section most dental hygiene students spend the most time studying because it covers instrument processing and sterilization. These topics are tested heavily on practicals, quizzes, and board exams. Everything below is based on your uploaded lecture. Part 4, Infection Control Audio Lecture Notes. Introduction. Now that we've learned how to protect ourselves using PPE, we need to learn how to make instruments safe for the next patient. One of the biggest causes of disease transmission in healthcare is improperly processed instruments. Every reusable instrument must go through the same sequence every single time. Remember this phrase, dirty to clean, clean to sterile. The sterilization area should always have a one-way workflow. Dirty instruments should never cross paths with sterile instruments. Instrument processing. Instrument processing is the complete process of making reusable dental instruments safe for patient use. Every instrument goes through several steps. 1. Transportation. After treatment, contaminated instruments should be transported carefully to the sterilization area. They should never be carried openly through the clinic. Instead, they should be placed in a puncture-resistant container to reduce the risk of sharps injuries. Step 2. Cleaning. Cleaning is the removal of blood, saliva, tissue, debris. Cleaning does not make an instrument sterile. Instead, it removes material that could interfere with sterilization. Think of cleaning as washing dirt off before disinfecting. Exam tip. Cleaning always comes before sterilization. If instruments are dirty, sterilization may fail because microorganisms can hide underneath dried blood and debris. Methods of cleaning. There are 3 common cleaning methods. Ultrasonic cleaner. This is the preferred method. Ultrasonic cleaners use high-frequency sound waves to create tiny bubbles. These bubbles scrub debris off instruments. This process is called cavitation. Advantages: less handling of sharp instruments, lower risk of needle stick injuries, more consistent cleaning. Memory trick. Ultrasonic cleaner equal to sound waves. Instrument washer. Some clinics use automated instrument washers. These machines spray hot water and detergent onto instruments. Advantages: very little direct handling, reduces employee exposure, manual scrubbing. Manual cleaning should only be used when necessary. It has the highest risk of injury because employees are handling contaminated sharp instruments. If manual scrubbing is necessary, wear heavy-duty utility gloves. Never use examination gloves. Always scrub below the water level if possible to reduce splashing. Inspection. After cleaning, every instrument should be inspected. Look for remaining debris, rust, broken tips, corrosion. Damaged instruments should be repaired or discarded. Never sterilize an instrument that is still visibly dirty. Packaging instruments. Before sterilization, instruments are packaged. Packaging keeps instruments sterile after they leave the sterilizer. Packages may include paper pouches, sterilization wraps, instrument cassettes. Packages also contain indicators that help verify processing. Remember, instruments are wrapped before sterilization, not afterward. Sterilization. Sterilization is the complete destruction of all microorganisms. This includes bacterial spores. That is what separates sterilization from disinfection. Definition. Sterilization equal to destroys everything. Disinfection equal to destroys many microorganisms but not necessarily bacterial spores. Exam tip. If spores survive, sterilization failed. Common sterilizers. The most common sterilizer in dentistry is the steam autoclave. Steam autoclave. Uses: steam, pressure, high temperature. This combination destroys microorganisms, including spores. It is considered the gold standard for most dental instruments. Advantages: reliable, fast, excellent penetration, dry heat sterilizer. Instead of steam, dry heat uses very hot air. Advantages: no moisture, less corrosion of some instruments. Disadvantages: usually requires longer cycles. Unsaturated chemical vapor. Uses: heat, pressure, chemical vapor. Advantages: less corrosion than steam. Requires good ventilation because of chemical fumes. Sterilization cycle. A sterilization cycle has several phases: heating, exposure, cooling, drying. Packages should be completely dry before removal. Wet packages can become contaminated because microorganisms can pass through moisture. Memory trick. Wet package equal to contaminated package. Sterilization indicators. How do we know sterilization worked? We monitor sterilizers in several ways. Mechanical monitoring. Mechanical monitoring includes checking the sterilizer itself. Examples: time, temperature, pressure. These values should be reviewed during every cycle. Chemical indicators. Chemical indicators change color after exposure to heat or chemicals. Examples include indicator tape, internal indicator strips. Important: chemical indicators only show that conditions were reached. They do not prove sterilization actually occurred. Exam tip. Chemical indicators do not prove spores were destroyed. Biological monitoring. Biological monitoring is the most accurate way to test sterilization. It is also called spore testing. Spore testing uses highly resistant bacterial spores. If the spores are killed, the sterilizer is working properly. This is considered the gold standard for monitoring sterilization effectiveness. Memory trick. Spores are the hardest microorganisms to kill. Kill the spores, kill everything else. Frequency of spore testing. Dental offices should perform biological monitoring regularly according to CDC recommendations and state regulations. If a spore test fails, stop using the sterilizer, review procedures, retest the sterilizer. Do not use questionable instruments until the problem has been corrected. Sterile storage. Once sterilized, packages should remain sealed until use. Store them clean, dry, away from contamination. If a package becomes wet, torn, opened, it is no longer considered sterile. It must be reprocessed. Instrument cassettes. Many offices now use instrument cassettes. Advantages: protect instruments, reduce sharps injuries, organize instrument sets, decrease handling, improve efficiency during cleaning and sterilization. Why instrument processing matters. Imagine one contaminated scaler being used on multiple patients. Without proper sterilization, diseases such as HPV, HCV, HIV, tuberculosis could potentially spread between patients and providers. Proper sterilization breaks that chain of infection completely. Quick review. Know these definitions. Cleaning. Removal of visible debris. Sterilization. Complete destruction of all microorganisms, including spores. Disinfection. Kills many microorganisms but not necessarily bacterial spores. Autoclave. A steam sterilizer using heat and pressure. Chemical indicator. Shows sterilization conditions were reached but does not prove sterility. Biological indicator. Uses bacterial spores to verify sterilization. Spore test. The gold standard for monitoring sterilizers. Cavitation. Tiny bubbles produced by ultrasonic cleaners that remove debris. High-yield exam facts. Know the correct order. Transport, clean, inspect, package, sterilize, store. Know these comparisons. Cleaning not equal to sterilization. Chemical indicators not equal to biological indicators. Autoclave uses steam and pressure. Spore testing is the gold standard. Utility gloves are worn while cleaning instruments. Never store wet instrument packages. End of Part 4 Summary. After this section, you should understand the complete instrument processing sequence. Why cleaning always comes before sterilization. The different methods of cleaning instruments. The three major types of sterilizers. The difference between sterilization and disinfection. Mechanical, chemical, and biological monitoring. Why spore testing is considered the gold standard. Proper storage of sterile instruments. Perfect. This is the final part of the lecture. We'll cover environmental infection control, disinfectants, barriers, waste disposal, and finish with the highest yield review of the entire lecture. This section is based on your uploaded infection control lecture. Part 5. Infection Control Audio Lecture Notes. Introduction. Even if instruments are perfectly sterilized, disease can still spread through contaminated surfaces. Every patient touches the dental chair, light handles, countertops, X-ray equipment, computer keyboards, pens, drawer handles. These surfaces become contaminated during treatment. This is why environmental infection control is just as important as sterilizing instruments. Environmental infection control. Environmental infection control means preventing microorganisms from spreading through surfaces and equipment. There are two major ways this is done: surface barriers, surface disinfection. Most dental offices use both. Surface barriers. A surface barrier is a disposable covering placed over equipment that is difficult to clean. Examples include plastic wrap, chair covers, light handle covers, keyboard covers, X-ray sensor covers, air-water syringe covers. After every patient, remove the barrier, discard it. Wash your hands if necessary. Place a new barrier before the next patient. Memory trick. Barrier equals replace. You never disinfect a disposable barrier and reuse it. Surface disinfection. Some surfaces cannot be covered with barriers. These must be disinfected. Disinfection destroys most disease-causing microorganisms on environmental surfaces. Remember, disinfection is different from sterilization. Disinfection does not necessarily destroy bacterial spores. Sterilization does. Steps for surface disinfection. The general process is: remove visible debris, apply disinfectant, allow the disinfectant to remain on the surface for the recommended contact time, allow the surface to dry if directed by the manufacturer. The disinfectant only works if it stays wet for the proper amount of time. Exam tip. Spraying and immediately wiping the surface usually does not give the disinfectant enough time to work. EPA registration. The lecture explains that disinfectants used in dentistry are regulated by the Environmental Protection Agency, or EPA. Every approved disinfectant has an EPA registration number. This tells you the product has been evaluated for effectiveness. Memory trick. EPA equals Environmental Protection Agency. EPA regulates disinfectants. FDA regulates medical devices. Housekeeping surfaces. Not every surface in a dental office carries the same risk. Examples of housekeeping surfaces include floors, walls, sinks. These surfaces usually do not require the same level of disinfection as surfaces touched during patient care. However, they still require regular cleaning. Clinical contact surfaces. Clinical contact surfaces are touched frequently during patient treatment. Examples include dental chair controls, light handles, cabinets, bracket tables, X-ray controls, computer keyboards. These require cleaning or barriers between every patient. Regulated waste. Not everything thrown away in a dental office goes into the regular trash. Certain waste is considered regulated because it may spread disease. Examples include blood-soaked materials, sharps, certain contaminated disposable items. These materials require special handling. Sharps disposal. Sharps should always be placed into approved sharps containers. Sharps containers are rigid, puncture-resistant, leak-resistant, clearly labeled. Examples of sharps include needles, scalpel blades, broken anesthetic carpules, orthodontic wires. Never place sharps into regular garbage bags. Hazardous waste. Some materials are hazardous because they can harm people or the environment. Examples include certain chemicals, some dental materials, cleaning solutions. These materials must be disposed of according to regulations. Improper disposal can create environmental hazards. Chemical safety. Dental offices use many chemicals every day. Examples include surface disinfectants, sterilizing solutions, cleaning agents. Every chemical should be stored properly, clearly labeled, used according to the manufacturer's instructions. Employees should know how to respond if accidental exposure occurs. Why infection control is a team effort. One person's mistake can expose everyone. For example, a contaminated instrument affects the patient. A contaminated countertop affects the next provider. Poor hand hygiene spreads disease throughout the clinic. Improper sharps disposal puts housekeeping staff at risk. Everyone in the dental office participates in infection prevention. The 4 CDC principles. Let's review the 4 principles one last time. Principle 1. Take action to stay healthy. Includes vaccinations, hand hygiene, education, post-exposure management. Principle 2. Avoid contact with blood and infectious materials. Includes masks, gloves, protective eyewear, gowns. Principle 3. Make patient care items safe. Includes cleaning, packaging, sterilization, proper storage. Principle 4. Limit the spread of infectious substances. Includes surface barriers, environmental cleaning, waste disposal, sharps management, memory trick, healthy, protect, sterilize, control, comprehensive final review. These are the facts most likely to appear on exams. Know the major bloodborne pathogens. HBV, HCV, HIV. Know the difference between recommendations, regulations. Recommendations come from CDC, ADA. ADS. Regulations come from OSHA, Cal-OSHA, FDA, EPA. Know the 4 modes of transmission: direct, indirect, droplet, airborne. Know standard precautions. Treat every patient as though they are infectious. Know the 4 major PPE items: gloves, mask, protective eyewear, gown. Know the difference between surgical mask, N95 respirator. Know the 3 glove types: medical examination gloves, sterile surgical gloves, heavy-duty utility gloves. Know the complete instrument processing sequence: transport, clean, inspect, package, sterilize, store. Know the difference between cleaning, disinfection, sterilization. Know that autoclaves use steam and pressure. Chemical indicators change color but do not prove sterility. Biological indicators or spore tests are the gold standard for monitoring sterilization. Know that. Surface barriers are discarded after every patient. Clinical contact surfaces are disinfected between patients. EPA regulates disinfectants. FDA regulates medical devices. OSHA protects employees. CDC creates infection control recommendations. Final memory sheet. If you only remembered 10 facts from this lecture, they should be these. 1. Treat every patient as potentially infectious. 2. Hand hygiene is the single most effective infection control practice. 3. HBV, HCV, and HIV are the major bloodborne pathogens. 4. Standard precautions apply to every patient. 5. N95 respirators protect against airborne particles better than surgical masks. 6. Utility gloves are used for instrument cleaning. 7. Cleaning always comes before sterilization. 8. Spore testing is the gold standard for checking sterilizers. 9. EPA regulates disinfectants, OSHA protects workers, FDA regulates devices, and CDC creates recommendations. 10. The goal of infection control is to break the chain of infection before disease spreads.